Dr. Quickly. So she, like I said, she is our new dean and the Jonas Salk Chair in Population Health, as well as the Professor of Environmental and Occupational Health here at Graduate School of Public Health. She comes to us from Tulane, where I think the weather is probably a little bit better right now than it is here in Pittsburgh, but hopefully you'll get used to it soon. Where she was with the School of Public Health and Tropical Medicine. She is a member of the Academy of Medicine. She has more than 35 years of experience in environmentally induced disease and health disparities. She spent time at the CDC and at the Department of Health and Human Services. She has a fabulous career that she's going to share some information with us tonight about. And so I'm honored to introduce you and excited to hear from you.
Great, thank you, Mara. And let me say thank you very much to all the alumni who are joining us. I have to apologize because I'm sitting at home, a temporary home, and above me and next door to me, there's construction going on and people talking. And so please bear with me as I do that. But let me thank you, first of all, for choosing Pittsburgh for your education. Let me thank you for staying connected as alums, and there's lots more to come and we'll do lots more together. I am so honored that you want to spend an hour and a half with us on an evening, and for some in the middle of the night, to see where we're going as a family. I am honored to join the family. And so as I shared with everyone, there's so much I need to learn. So tonight it's a bit about both, a bit about learning about me somewhat, but above all, learning from you and interacting with you. And so let's see. I will share my screen. Can you see that? Mara, can we see the screen? Okay, great. And so what I'd like to do is share with you kind of where my career started, where I started as a human being, and take it from the Amazon rainforest all the way to Allegheny County, where I currently am. Let's see. It's not, here we go. And so what I'd like to do, in addition to introducing myself, present to you a bit about my career, my highlights, but really spend more time on my vision and strategic imperatives, above all, to get to know you. And so here is a bit where I come from. My research is focused, as Mara indicated, is transdisciplinary in nature, focused very much on disparities and disasters. And yes, the pandemic is a disaster. I've worked a lot during my 20 years at the Centers for Disease Control and Prevention on infrastructure and capacity building and mentoring. My leadership in public health really straddles not only the mechanics of strategic planning, but also a number of times, areas, and ways to do development and fundraising. And I'd love to learn some more and talk to you about that. I am very keen on partnerships, particularly with communities, but also with industry. Working together, not only intramurally, but externally with partners, and including with policymakers. I am a spouse, I'm a mom, and I'm also a Mimi of 3 little ones that you see there on the right. So where is Suriname? That's where I was born. It is one of the Guianas, as you could see. In the middle, it's one of the middle Guianas, and it used to be a former Dutch Guyana. And so some people think they want to place me in Sumatra, in Asia, or sometimes in Africa, but it's really in the Caribbean. That's where I hail from. And usually, particularly when I meet with students, I have a little quiz at the beginning and ask them to guess what my accent is and where I'm from. And so obviously we won't do that now, but I'd love to hear where you think my accent is from afterwards. This gives you another ID of in the area where Suriname is. Much of my research is happening in the Amazon rainforest. That's where I first trained as a physician, and that's where I'm back until 2 years ago with students from Tulane, but still doing research there. And I hope to take students and alums, if you're interested, with me to Suriname for research and training. This is me at 6 months, and I'll tell you a little story about my nickname called Little Dove in a bit. Yes, I'm a bit larger in terms of size, and I also have many more gray hairs than I had back then. But this is me graduating from the University of Suriname after spending half of the time at the University of Leiden in the Netherlands. This truly is where my career started, in a dugout in 1979, where I practiced as in my last year as a physician in the Dutch system. It's an 8-year training program. And in the beginning, I didn't have an outboard motor that was given to us by an organization, a not-for-profit organization. I had a boatsman who then we would paddle and visit the villages along this river. It is also this river where I want to return in the next phase of life, where my ashes will go. And a number of things I've learned while practicing as a young physician. One was that community leaders can be as important partners of research as are your colleague researchers. And here are two of those community leaders that I've then trained as a young physician to be community health workers. One was a nun and the other one was a local community leader. And together we were able to go from 5% immunization coverage in children 0 to 5 to 95% in about 3 years. But really my aha moment for public health came at this farmers market, where whatever I did, whatever people had in terms of complaints, had some relationship with the environment. I spent first, when I arrived in the country, I spent about 20 years at the federal government. In this case, the Centers for Disease Control and Prevention, first as a medical toxicologist, and then as a division director in the area of health education and promotion, but very much involved in environmental health and looking at exposures to people from environmental contaminants, from chemicals. My career at the federal government at different levels of leadership included in 1988 developing the first ever, the science around the first ever act to track medical waste. If you recall, in 1998, there were syringes washing up on beaches, and people were very concerned that there would be HIV transmission. And so this was one of the very early environmental policy accomplishments. Things in public health always happen on a Friday afternoon, and it was on a Friday afternoon that I had a call from the state health officer in Mississippi, who indicated that people were complaining about headaches and shortness of breath. The symptoms looked like the flu, but weren't quite the flu. It turns out that two non-licensed pesticide applicators decided that they were going to help the community, and they were spraying indoors with methylparathion. And methylparathion is actually exclusively for outdoor use to kill beetles on cotton crops. They guaranteed their work, so much so that they left behind milk jugs of undiluted methylparathion so that the people could spray themselves. And obviously we had thousands of people exposed. We were able to, for the first time, use public health data to be able to manage the risk and to protect those that were most vulnerable. So my work and my devotion to health disparities research and protecting particularly people who were pregnant, women who were pregnant, and the young children came very early. I went back in 2008 for the first time after decades to Suriname, where I was honored to be the commencement speaker at the 40th anniversary of the University of Suriname. And so that was very special to me. Here is the story about my nickname. Several years ago now, I was invited to give the inaugural address for starting a new MPH program in Shantou. And so I asked and practiced for a long time how to say Little Dove, my nickname, in Cantonese. And so at the end of this inaugural address, I thought I would just give it a little bit of a cultural accent and said, well, Little Dove is glad to be home. And afterwards, I thought, well, I've asked very proudly. I said, well, was it good? I had a polite applause. And my colleague said, yes, it was very good. I said, didn't you even like? I said, Little Dove in Cantonese. And he said, yes, you did. But actually, what you truly said was you were a hole in the wall. And so I stopped trying to practice speaking Cantonese with the Dutch accent. So here you go. With one of my focus areas at Tulane, and so I joined Tulane 3 weeks before Katrina, and with so many others lost everything. But building up a center that focused not only on the physical, biological, and societal needs, but also on population health and the environment, provided really the cornerstone of my research portfolio. And you could see some of the areas of focus in the center that I continue to lead. One other major disaster was the Gulf of Mexico oil spill in 2010. If you remember, in 2010, it was the largest oil spill that occurred, and the largest amount of dispersants were used back then. 11 men who worked on the rig lost their life, and a number of communities were impacted. One of the things that was really important for me, as you recall sharing, is working with the community. And one of the key questions and concerns the community had was the seafood safe to eat after this oil spill? So what we did, instead of buying fish and shrimp on the market, we actually went shrimping. This is to the left is one of our students back then at Tulane. We went shrimping with the community leaders, and to the right, you see Danielle, who went shrimping with us. Because we did that, we were able to show that, yes, the shrimp were okay to eat, but we did that using local data, local shrimp, and what the people ate, not what they sold, because the bycatch, what was most important for us, because that's often what local Vietnamese fishermen and fisher folk would eat. In addition to the research that we were able to do, the court assigned and out of the medical settlement gave us $105 million to just do good, not research. And so what I was able to do and help design was a $105 million program that focused on building capacity and doing more with the practice environment. When I talk about my priorities in a bit, you'll see my emphasis on working more on the front line of public health practice, so that our science developed by us and represented by so many of you as alumni is helpful, useful, and helps promote health on the front lines. In Suriname, we created one of the 7 Caribbean Consortia for Research in Environmental Occupational Health. And that focus is on looking at exposures to mercury, particularly mercury and pesticides. And I'll take you back to Suriname. And this is not the same rainforest that I was used to when I practiced. This is rainforest that disappeared in the span of about 2 hours where gold mining is happening. So after dredging, the mud is then put through a very primitive device called a sluice box, where mercury is added, and you could see the result of that in local ponds, that green water. That's the sluice box that I mentioned. And so while mercury is added, mercury is not captured. And so the mercury residues are going into, in this case, the lake and the river, and ultimately accumulate in what is the most popular fish and the most abundant fish in those waters, and that's the piranha. And so for those who are not in environmental health, the bioaccumulation happens when mercury is in the sediment, plankton ate, it's accumulated in plankton, the little fish eat the plankton, the big fish eat the little fish, and humans eat the big fish. And so what we are able to do is now with 1,200 women and 1,000 babies, so a diet, in looking at what the exposure is through the diet, in the environment, in occupations, what the levels of concentration and contamination are in fish and in produce, nutraceutical compounds, so herbal components and that are like fruits and fruits particularly that people use for health reasons, but that could also be contaminated. We have a pilot project around climate change that's going on. And primarily we're focusing on the impact of those exposures on bird outcomes and neurodevelopment. So currently 1,200 women, as I mentioned to you before, 10 sites, and I practiced around sites 1 and 3 when I was in Suriname. And here are some of the levels. These are the first data results of the 1,200 women. You could see in the interior, that's in the Amazon rainforest, this is mercury in blood. The United States Environmental Protection Agency action level is where that dotted horizontal line is, and you could see some of the levels and the elevated concentrations in people's blood, in some of the women's blood of mercury. So you could these levels are far higher than we ever see in the United States. Here is in one of the areas in the western part of the country where I explain in my best Dutch what the concentrations are, what we found, and what the next steps are of the research. In addition to mercury, we also found lead. And again, if you look at the levels in the same population in the interior, above what the Environmental Protection Agency would see as an action level. So in a way, these women are getting a double whammy in terms of exposure, and their babies in terms of potential adverse neurodevelopmental effects. And so from metals, we're now looking at pesticides. We also considered, as part of this research, pesticide exposure. And you could see what there are currently no formal policies in place yet in the country and in many countries in the Caribbean. And so everything is imported, from insecticides to herbicides to rodenticides, and in addition to household pesticides that are being used. Here are some of the common sources, and to the left you see a crop duster spraying, but often the crop duster doesn't only dust the crops. Often they also go over schools, where whole schools have to be closed because particularly asthmatic children have a problem breathing. There is a story about the mosquito coil. As a child, I played with mosquito coils. It was under my bed. My mom put it under my bed so to make sure that I am not being bitten by mosquitoes. I lit the cigarette of my father with the mosquito coil. But it turned out that when the Zika epidemic happened in the Caribbean about 2 or 3 years ago, there was an import of 500,000 mosquito coils. There was suspected that those mosquito coils were not what they should be and were actually contaminated. And so at Tulane, we analyzed the coils, and lo and behold, the concentration of the active ingredient, the pesticide, was lower than what was on the label. And secondly, what was not on the label and what we found is lead contamination. And so if you would be using this particular mosquito coil, you would get less of an active ingredient, and in addition, contamination with lead in the air. And so we were able, our research, and we published this, was able to stop the import of the coils. Here are the really important consequences of not having environmental policies in place. This is pesticide spraying happening, and where people are also in bathing in the same water stream. The power of community leaders and community health workers as researchers, took that with me all through my research. And here are community health workers, community leaders graduating from the 80-hour competency-based training that I've done. And they now are very integral to the research that's currently taking place in Suriname. In terms of pesticide exposure, 2,4-D is well known as not something that should be imported, not something that should be used, but you could see the 2,4-D levels in women. These are the urinary metabolite of 2,4-D in the very area that I just showed you, where it's a heavy emphasis on agriculture. We did a lot in terms of training in addition to the research. And I'm very proud of having all these Surinamese PhD students who will be graduating this summer. This one graduated a year or so ago. Very involved with environmental health training around the Caribbean, and this is our last training we did in person for all 26 small island nations, and hope to continue these efforts here at Pitt. And this is the capital, where I'd love to take you sometime. And I'll pretend that you are one of my students that I take with me, and hope to do so with the University of Pittsburgh students to Suriname for learning, and particularly for surface learning as well. This is the Ministry of Health and the Pan American Health Organization. Excellent food and vegetables. In the middle is Uncle Fritz. Uncle Fritz is a medicine man who had a 5th grade education, but knew all the plants and medicinal plants by their Latin name. I had Latin 6 years, but I was so impressed with that. And we take students also to the US Embassy, and we celebrate the 4th of July there together. One of the things that students do is they rescue sloths and feed them, and then when they're when they're ready to go back into the rainforest, they're released. The sloths are driven out of the rainforest because of the gold mining. They love the hibiscus they feed on that. We also visit the habitat of a very rare type of dolphins that are only present on the coast of Suriname and some in Brazil. And we get a full dolphin show while on this trip. It gives you a sense of how we travel during the trip. And yes, it's hard work to get in and out to, this is a reservoir where saltwater intake is endangering the species of birds to the right. Very seldom monkey there. Indeed, also very unique frog in Suriname. This is a sense of where we stay, right here on Tonka Island. This is everybody awake at 6:30 to see the sunrise. I'm hoping that together the sun will rise on our school as we go into what will be my priorities in a minute. This is me talking about a cup that has antipyretic qualities, and so if you would put hot water in it and you would drink that water, it has the same effect as drinking Tylenol when you have a fever. This is our group together. So what I want to do now is really take some time to talk about my strategic imperatives and priorities coming in as the new dean of the school. As part of my interview, and now as part of my deanship, there are 4 strategic imperatives, and your role and your contribution and your support as we implement these imperatives and priorities is absolutely key. And so I'm really looking forward to have a lot of time to spend on each of these. So the highest priority for me is to get us as a top 10 ranking school through particularly doing more transdisciplinary research across the departments rather than only in the department. Our board of visitors and some of you on the call today are members. Thank you so much for guiding us. Actually have challenged us to say we could be in the top 5. So well, let's take that step to go into the top 10 first. We're currently, if you're wanting to know, we're currently ranked 13 in the nation. It is really important for me to help us diversify the educational enterprise by building more pipeline programs. And one of the most important, well, actually the most important pipeline program we're currently working on is the Bachelor's of Science in Public Health. Many schools of public health have a program like that, but very few schools have one that goes all 4 years. And so I'm very proud that, and if you don't know that secret, I'll give it away. Mara Leff will play a leadership role in helping us really operationalize the Bachelor's of Science in Public Health beginning this fall. We'll also work with the School of Medicine on adding to our existing MD-MPH program and making it also a 4-year program. Key too is that we look at other, from a training perspective, education perspective, other masters, pandemic science, global health, health equity, climate and health. Those are all areas that I would like to grow together with you, with the faculty, with the staff, and with you, and particularly, of course, learning from you as alums how that would work since you are in the real world. Then also critical for us to advance is to create greater collaborations with UPMC and particularly with the health plan. I've immediately started working on that, and we are have specific projects already in focus for us to do things together. And ultimately, and here is where I absolutely will need your help, is and I don't have one. I don't have a rich uncle or aunt, but helping us identify how together we can have a development portfolio that will help us name the school. think the school has enough of a national and an international profile is worthy to be named. And I look forward to your advice of how to do that and who to contact, who would be interested in what we're doing. In terms of priorities, my highest priority is developing that transdisciplinary research through what I call precision public health. So many of you, of course, know precision medicine, where we really focus on what the specific characteristics are genetically and otherwise of an individual person so that we can tailor treatment to that person. It is the same for communities. So in precision public health, what we're aiming for is focusing on what the key issues are, the key public health problems in a community, and tailoring our research, our teaching, and our practice to those problems at the community level. We can only do that by working across departments. And we have already submitted one grant related to that. I already talked about the BSPH and the MDNPH. Also very high, and Mara mentioned that on my list, is to advance, improve, expand our diversity, equity, and inclusion efforts. It is a university-wide high priority. It is one of my highest priorities in our school. We are not diverse at all, not in our faculty, not in our staff, and neither in our students. And so I'd like to work with you to make that happen. And that means hire more faculty that are underrepresented. We did put 2 grants out already to that effect, creating a pipeline from high schools, particularly public high schools, into the Bachelors of Science and Public Health. And so there are a number of initiatives that will help us do that, but I look forward to learning more from you in terms of ideas. And then I mentioned before, I was a bit surprised that we don't have a good anchor for research and for education in climate and health, given the high priority and the public health threat that is posed by climate and health. But we have a good way and good foundation to start in several departments. And the same is the case with global health. The academic health department, I mentioned earlier to you, with my time spent at the Centers for Disease Control and Prevention and also my time spent at Tulane, I always worked very closely with state and local health departments, and I will do the same over here. I've already had contact with both the state and local health department, and looking forward to do that cross-fertilization, meaning that our faculty would work with local health department professionals to do something with the data, so much data that they have to address real world problems. At the same time, we will be placing, as we're already doing for many, many years, our students for internships with local health departments, but also have lead practitioners be joining us and teaching our students before they go out in the real world. The university is investing in community engagement centers. I've committed our school to be very involved in the newest one that's currently being developed in the Hill District. But a footprint in the community means a footprint in the community, not only locally, but as you see from my research, very much also globally. And then we will be thinking about, as we implement this agenda, and all of our units, all departments and other units within the school are currently working on an asset and gap analysis. We will be thinking through how to connect our departments to this transdisciplinary science and education. And that might mean changing some of the names of the departments, of some of the departments. And so I want to end and give us a chance to have a chat by saying thank you in the Surinamese local language. So Grand Tani. And so let me stop sharing and looking forward to your questions.
Hi, Dean Lichtveld. We had a question to kick things off here that would be a good one to start with here. We have a question submitted about the BSPH and what will be your main priority for the BSPH in terms of focus areas for the degree?
Oh, thank you so much. And so there will be 3 levels of courses. The first level will be very, very foundational. What is public health and what's a cell? The second level will be all the core courses that we currently have at the graduate level, but at the undergraduate level. So epidemiology and biostatistics and environmental health. So all of those will be at the second tier. The third tier of courses, and that's where the answer lies, is that I'm asking each of the departments to develop what are called specialty tracks, so that students who graduate from the BSPH can already begin to take a set of courses that will naturally lead them into the department of choice. So if somebody wanted to do environmental health, I'll be biased a bit here. If somebody wants to do environmental health, they could take the 5 specialty courses that are leading them naturally into the department. In addition, and I helped develop this program where I was previously. But in addition, what we will do is we will also create a combined degree, a combined BSPH MPH degree, where students can apply in their junior year to the master's program and transition into the graduate school already then and begin to take courses with us. They will then gain about a year when they do that. We will also create specialty tracks in other health sciences schools, and particularly the School of Rehabilitation Medicine is very interested, as is the School of Dental Medicine. And so we'll be doing things like that over time. But we will start with the BSPH this fall, beginning with the upperclassmen, and then in the fall of 2022 begin as first year admission. So this will be a first year admitted program.
That's great. We had another, so I think that it's been such an interesting year because of COVID, and unfortunately, lots of us who have enjoyed traveling personally and professionally haven't been able to do this. We had a question from the chat here, a Pitt alumna and a student in BCHS. If students wanted to take part in research and training in Suriname, what's the process like for applying?
And so I have to establish that course again. So once I establish, actually there are 2 ways to do that. I will establish the course again once I get a handle on what's going on. I'd love to take the students, and then once the course is in place, then we can do that. The second, though, is another program that is funded by the Fogarty International Center, and Suriname is a training site for that program. So the applications will start around July, maybe August, and they're due in December. And so as soon as they come out, as I promoted always the university where I was, this year I will promote heavily the students here, both pre-doc and post-doc students, to apply to do their research in Suriname. And so those are the 2 avenues, and probably the latter is the quicker avenue, because I imagine that this summer I can't go off and teach, no matter how much I wanted to, but there are other priorities.
Dr. Lichtveld, I had some questions come in about alumni student mentorship. How do you think we can work on that and to increase opportunities for folks?
I am so excited about that opportunity, and I would want to work with the leadership of alums of the alumni organization to be the matching place where my experience is where when we have from each alum kind of the area of expertise, and we have the students and the practicum, we can do matching working with the alumni office. And so I very much would look forward to that, doing that, because that's the best way for students to, one, create a natural network when they graduate, and two, have some real world expertise. We have to, if it is for the formal 200-hour practicum, it will have to comply with the rules, of course, of our accrediting body. But it could also be for a smaller internship if that's not the real practicum. I should also mention, and I failed to do so, is that the students in the undergraduate program, just like students in the graduate program, will do 120 hours of surface learning. And they might really love to connect with our alumni as well.
That's great. Thank you. Another question popped up here. What are your strategies for increasing community engagement between school and Pittsburgh communities?
That was one of my surprises, actually, that the school was not, the faculty were not as connected as I would have hoped. And so in addition to working directly with communities in the Hill District, we are promoting, and I am personally promoting, community-based participatory research so that we can have better connections with our communities. We're looking at, we have a community research advisory board, but I think that's not enough. And I'm critically looking at our board of visitors and seeing whether we're talking about that, include community leaders as part of our board of visitors as well. But doing our research in the community, learning from the community, bringing communities in for webinars or seminars, just as we're doing other colleagues in academia, and really addressing community problems by being in the community. You cannot address community issues and you cannot learn about the community assets, because communities not only have problems, they have tremendous assets. I've worked all along communities in my entire career, is to be in the communities. You can't learn or work with communities by sitting in a building at 130 DeSoto Street. Just can't. You have to be out there.
Are there any other questions? Feel free to unmute as well, and we can.
Yes. Just have a, you don't have to write it in the chat. Just we can talk. Anybody unmuting?
Hello, this is Rafi. I'm from Istanbul. It was a nice presentation. It was very nice to know you get to know your work since now. Now my question is, how are you going to diversify the number of students applied to the school? I know that in my time in the 80s, the graduate student in the school, very diverse from all over the world. But later on, majority of students from mainland China. I don't know now the diversity now. How are you going to accomplish this diversity in the number of students coming in, applying to school?
Yeah, thank you so much for that question. In the last 4 years, we had a real problem with getting international students visas so that they could join us. I'm hoping that with this new administration, that will be different, so that we can welcome more students internationally to our campus. It is a source of learning for our students here as well as our students international. It's only enriching, and it would enrich our culture as well. It would help us to expand our reach, and it would help us to create a more common community, especially if we need to address issues like a pandemic or climate change. And so we're hoping it's a visa issue. that has prohibited us from getting more students on campus. I also should say that I didn't mention some of the intramural or internal changes that I will be making. We have not done a lot of marketing on the outside, and so we're like our best kept secret, and we can't be that. And so I'm hoping that after today, each of you will be part of my marketing army, so to speak, and to talk about the School of Public Health. I'm hiring a communications director to make us much more visible, both locally, nationally, and globally, in terms of marketing and attracting students. I'm also putting in place an office of research and an associate dean for that office. And so because then we can forecast and do better in terms of increase the research portfolio of our school. And so those changes are all meant to help, as we are also establishing an office for undergraduate education, helping us to grow. And I saw a question in the chat flashing, maybe.
Sure. So Lauren had asked here, do you have plans to make the MPH programs more accessible? She'd love to see more evening classes to include non-traditional students.
I agree. And in fact, the Provost has asked that we especially pay attention to mid-career and students on the regional campuses. And so we will be working on, I know there is an online version already of our MPH, but definitely the BSPH, we will be putting fully online as well.
That's
and
great.
yes,
I think,
please feel free to give my email address. So.
Well, I think in the past year, obviously, I mean, we've all had to, the school has pivoted to be, you know, remote, and there's so much remote learning going on. So I think that there's some interesting pockets, interesting areas of opportunity. And I think that there's some strategies and tools that that the faculty have really employed, faculty, staff, and students, and new ways to connect with alumni as well. And so I think that those are definitely going to be some exciting things for us to continue to explore.
Yes, thank you. And I saw a message or a suggestion about grant rounds. Absolutely. We should renew those. And also, I would hope that some of our alums would volunteer to be grant round speakers. And so let us know through the association, and we would be honored to host you, unfortunately still via Zoom in this format rather than in person, but hopefully we'll turn the corner with this pandemic, and the fall might look different. Other questions?
Okay, can I ask one more question?
Of course, yes.
Do you intend to increase collaborative agreement with the other School of Public Health around the world?
Yes, very much. I know there are schools, there are many schools in public health. I will be very active. I have been when I was at the Centers for Disease Control and Prevention, but I'll be very active in the leadership at the Associations of Schools of Public Health, Schools and Programs of Public Health. And then there are international schools that are also connected to that, but I'll be very interested in connecting with schools of public health across the globe. And so, yes, absolutely.
Okay, thank you.
And there was another question that just came through, Dean Lichtfeld. What are your ideas for enhancing interdepartmental collaboration, conversations, and general cohesiveness? How do we get everyone playing in the same sandbox?
Excellent question, and one that is one of my highest intramural priorities. Silos do not make us rich. Silos divide us, and when we are divided, we can't stand together. And so I'll be, the transdisciplinary research requires that faculty work across departments. In fact, just yesterday afternoon, I submitted 2 grants where 6 faculty members participated from all different departments, and all 7 department chairs collaborated on those two proposals. And so we'll be doing more of that. I'll put in place incentives, money, awards, preliminary data to collect preliminary data, but with the condition that it is one across departments and two, in many cases, across the health sciences. And so I'll incentivize that to happen.
I can read the next question, which is, it's a good one. One of the most difficult public health problems that we are facing globally is the problem of resistances to medications. COVID-19 seems to have such features. Do you have any plans to address this problem, medication resistance?
I keep on saying that the current pandemic, the COVID-19 pandemic, is not a clinical issue. It's not a medical issue. It's a public health issue. And until we are addressing it with the public health tools we have, education, health promotion, explaining why vaccines and why vaccinating people is important, but why equally important and often more important is wearing your mask and keeping the physical distance. That's what public health does. But up until recently, public health didn't have a voice. My former agency, CDC, didn't have a voice. And so one of the things that I'm looking forward to is that the next interview that happens about any disease will not be a researcher, although I'm a Hopkins alum, will not be a researcher from Hopkins or Harvard. It would be one of our faculty, either me or somebody else, in the Graduate School of Public Health, because we have the expertise, but yet we are not outward facing. And that's one of the things that I will do, is help us be more facing outward. Other questions?
Sure. Lauren asked here, are there plans to offer scholarships or funding for BS, PH, and MPH students?
We intend to have scholarships. And in fact, the scholarships that we had last year resulted in a boost of our students in the applications into the MPH program. This year, we are, so embedded in the BSPH will be scholarships as well. This year, we are not stopping the applications coming into our school. And I'm hoping that you will help us market our school in terms of MPH applications. The master's applications were down across the board, actually nationally, but some schools are picking back up significantly, and we want to be part of that some school group. And so I'm hoping that you will help us publicize the quality of the education that you've had when you were here and connect with us. Please feel free to connect with any of us directly. You can connect with me or any of the people in our faculty or staff in student services. We would love to help get an application in. I should also say that university-wide, and we will be one of the schools that are doing that, we are suspending the use of the GRE as a requirement. This is critically important so that we broaden our pool of bright students that we would otherwise miss by having a requirement for the GRE.
Does anyone else have any other questions? Just Mickey had a nice comment about outward facing work will help. Here's one. What is your vision to strengthen partnerships with joint degree programs or expanding the joint degree programs themselves?
I very much support that. We have a number of joint degree programs with with social work. We have obviously with medicine. We have one. We will have soon one with rehabilitation sciences for physician assistants and infectious disease. And so I'm very much in favor of joint degrees. One, it's better for the students, and two, it's also good for us, budget-wise, revenue-wise. but it exposes us to a different mixture of students and students with different skills. It also brings faculty together as well. And so while obviously we are a tier 1 institution and we need to strengthen our research, as a public university, our mission is also to educate. And so we'll pay attention to that part of our mission, as is our mission to provide service. And so I take those two pieces as critically important as, of course, our standing in the research is. We are doing a great job in terms of faculty, our faculty research portfolio, particularly for the National Institutes of Health, but we value all research, whether it's coming from the Centers for Disease Control and Prevention or from a foundation. Being active in research is a requirement to be a good teacher. And so we see those two components very integral.
Wonderful. Anyone else?
And yes, please, everybody let me know if you want to be, you can help us be that ambassador for our school, to market our school. I would hope that we could stay connected. I also hope that we could knock on your door to help us build scholarships, whether they're in your name or contribute to a scholarship. I'd love to get ideas from you, whether there is a scholarship that comes from the alumni organization or there is a scholarship named for you, named after you, to help us do that, or whether it is a contribution to a program or a naming of a specific joint degree, or a naming. I should tell you that very soon we will be announcing the search for a chair in the Department of Biostatistics. I very much would like to have every chair that we hire to have a chance to be a member of the National Academy of Medicine, just like I am, and to have an endowed professorship like I do. And so it shouldn't stop with the dean level. It should be at the leadership level as well as at the department chair level. So to the extent that you can help us, think about, identify potential funders. You might be that very person. Please connect with me. We have a bright future, but we need those incentives, both financial and resource-wise, to be that. And I take spending time with us, spending time with our students as tremendous contributions as well. Thank you so much.
Thank you so much on behalf of all the alums here. That was wonderful. And I know that this is just the beginning of the conversation with you. And I know that you want to keep the lines of communication open, which is very appreciated. And I know we're already hopefully planning something, another one of these chats with you for the near future. We will be sending out an email. Jennifer and her team will be getting out an email with contact information, how to get in touch with the dean's office. And I hope everyone has a good night. Thank you again, Dean Litchfield. We loved having you, and we're so excited that you're here.
Oh, I can't think of a better way to spend my evening than doing just that, connecting with alumni. Thank you for having me in your living rooms or wherever you are. And Mara's correct. We'll be having these conversations many more times during the year. I look forward to coming back to you and telling you how far we are. And I hope to hear from you next time how you could become an active part of our team and making this school the best public school of public health there is in our country. Thank you. Bye-bye.
Bye, everyone.